Everyone. Good evening. Um, so it's just time for our health talk now, and this evening we'll be talking about hypertension. Myself and Dr. Sean Falashe would carry on with the presentation. And the reason we've just chosen this topic is because it's one of the things we've dealt with before, but we've chosen this because of the prevalence of it and the fact that we are beginning to see more people come down with complications. We're seeing younger people being diagnosed with hypertension these days. And the fact that also is a lot of people, who are walking around with a high blood pressure and are not aware that their blood pressures are high. So there's a few things, a few salient points that we'll talk about, and I hope that you're all blessed as you listen. Just to remind you that if you have any questions during the presentation, please leave them in the chat and we'll try to address them by the end. Thank you very much. Over to you, Dr. Sean Falashe.
Good evening, Church. I will be discussing hypertension this evening. And just like Dr. Owele said, we thought we would take this topic again due to the prevalence. Okay, so just get right into it. By way of introduction, it's one of the leading causes, that's hypertension. Why is it important, really? It's one of the leading causes of death and disability worldwide. If we just think back, we don't even need to think deeply. We know more than what each of us know more than one person that has hypertension. And so that gives us an idea of how prevalent, how common it really is within our community. And even around 5 million people in the UK have undiagnosed hypertension. So they're just people walking up and down, walking with blood pressures of 180, 100, 190, 120, 200 and above. And then they're just walking like nothing is happening, well, until they cannot. So it's also termed, hypertension is termed the silent killer because it usually has no symptoms. On its own, it would usually have no symptom. By the time you start seeing any symptom, it's usually of the complications that we will delve into and because of this presentation. It affects all races, but usually there's a higher prevalence in us blacks, due to several factors. It can affect children, although less commonly, It can cause serious damage to important organs. Hypertension and its notorious cousin, diabetes, they would usually affect the very important organs. The brain, it can cause stroke, and then it can bring about blindness, glaucoma, heart disease, kidney disease. Those are what few of the complications that can come about from hypertension. So, what is hypertension? Virtually everybody knows. It's increased blood pressure. And then our blood pressure is usually a combination of two numbers, the upper one, which is the systolic, and then the lower one, the diastolic. So the upper systolic value measures the pressure in our arteries when the heart is pumping blood, when the heart is contracting, whilst the diastolic is the pressure in the arteries when the heart is receiving blood or when the heart is relaxing. And usually we expect for the normal value, would expect a value of 120, 80, or even less is better. And then, but for raised high blood pressures rather, a value of 140, 90 or more is diagnostic of hypertension. There are three stages, The first stage, stage one, a value of 140, 90 to 160 over 100 in the clinic. So if the blood pressure is checked in the clinic by the hospital, in the hospital, that value will be stage one. Or if it's checked at home, maybe you have your blood pressure monitor in the house, any values between 135 over 85 to 150 over 90 in the house would be stage one hypertension. Stage two would be 160 over 100 to 180 over 20 in the clinics. Yeah. And then any values above 150/95 in the house, any values above those is stage 2. While stage 3 would be any value above 180/120, regardless of whether it's in the hospital or in the house. That's already severe hypertension. And usually we would, just like I mentioned earlier, can either be checked in the house. We check the average of the average blood pressure readings. So they would usually advise twice in the morning, twice in the evening, and check an average of those. Or the ambulatory blood pressure, which is usually done over the course of a period of time. There's also something called the white coat syndrome, which, I mean, there's a few people that once they get into the hospital and then they say, oh, they're going to check your blood pressure. That's when the blood pressure actually goes up. And so for people like that, they would advise them to go home. I mean, either check the average blood pressure readings in the house or have the ambulatory blood pressure checked in the house. Yeah. So we'll move on to the risk factors. There are the non-modifiable ones as well as the modifiable ones. For the non-modifiable risk factors, just like the name suggests, we cannot do anything about it. The older we get, the higher the risk of coming down with hypertension. I mean, just like wear and tear, our blood vessels are getting weaker. So there's the higher chance of coming down with hypertension. Also, our color is commoner in blacks, yeah, due to several reasons. Our gender, so for men, it's due to the absence of estrogen, which is one of the hormones that women have in their reproductive years. Estrogen is usually helpful with relaxing our muscles, and then in the long run, it would bring about a reduction in blood pressure. So men do not have that in surplus. So the chances of them having high blood pressure is higher. Also, genetics plays a role in the prevalence. Yeah. So for a lot of us would hear things like, oh, my father has high blood pressure, or there's usually a thing with hereditary. Yeah. So risk factors. Okay, yes. So we'll move on to the modifiable factors. So for our modifiable ones, our body weight, obesity plays a role in high blood pressure. Also, our salt intake. For a number of us, we love to take salt. We sprinkle salt even after we've cooked food. All this increases our chances of coming down with high blood pressure. Smoking. So smoking also is a risk factor. Smoking would bring about a damage in our blood vessels. It will cause inflammation in the blood vessels, and then eventually there would be high blood pressure. Sedentary. Okay, so exercise. We need to exercise. So for a lot of us, it's also linked with our body weight as well. So for a lot of us, we're quite sedentary in our lifestyle. We don't walk. We don't do exercise. So all of this increases our risk, increases our chances of coming down with high blood pressure. Yeah. Okay, other risk factors would be intake of alcohol as well as coffee, drinking coffee and caffeine-based drinks as well. Stress, when we're stressed also, I mean our body produces some hormones that puts our body in a fight or flight mode, and all these hormones bring about some chemicals that can increase our blood pressure in the long run. There are also secondary hypertension. So secondary hypertension is the hypertension is due to something else. So the hypertension is just like the name suggests, secondary to something. So it can be due to diabetes or a kidney problem or thyroid problem as well. um Drugs like steroids, contraceptive pills, they can bring about hypertension when all this. Okay, complications will be taken by Dr. Lano. Yeah.
Thank you very much. Thank you very much, Dr. Shion Falashe. So I'd now take the complications of hypertension. Please remember to leave your questions in the chat and then we can answer them at the end of the session. So we'll go straight into the complications. So the first one is memory and cognitive problems. So what happens over time with people who are hypertensive or have a high blood pressure is the blood vessels, that supply the brain or parts of the brain, parts of the brain that's responsible for things like your thinking, things like memory, rationality, personality could be affected. Parts of those brain could be damaged with prolonged years of high blood pressure, especially when it's poorly controlled. And what we often see is later in life, they come down with dementia. And that type of dementia is called vascular dementia. And unfortunately, with other types of dementia, there is some form of treatment that doesn't cure dementia, but slows down the progression of dementia. But vascular dementia is not one of those. So it's really important with people who have a high blood pressure to ensure that it's well controlled and they're compliant with their medications. The other complication is a stroke. So as we saw, she gave us a list of the different classifications of a high blood pressure. And if we remember, the stage 3 was a high blood pressure of above 180 over 120. So usually at that level, what can happen is because of the pressure in the arteries supplying the brain, they could burst and, and people can bleed into the brain. And what you tend to have, with this is you might find people might complain of a really severe headache, with a high blood pressure. They may complain of, they may have like weakness affecting one side of the body, slurring in their speech, weakness, etc., or weakness in the face. Those are all signs of stroke. And the sad thing about this is that people may not necessarily know they're having a high blood pressure, because it's a silent killer, as was mentioned earlier. And then the first time they discover that they have a high blood pressure is when they present as a medical emergency. The third complication is visual loss, which typically affects the part of the eye called the retina. So the retina, what it does is one of the layers in the back of the eye, and it's takes in light, and it converts that light to a signal that the brain then translates into visual images. But with a high blood pressure, it could damage parts of the retina. And then what you may find that is your vision is diminished, or you may find that you're starting to have blurring in your vision, or you're seeing double, etc. So that's how a high blood pressure can affect the vision. Heart failure as well. So what happens is, with hypertension or with high blood pressure, the blood vessels are quite narrow. They're very stiff. So the heart is having to, pump blood through stiff, arteries, and that puts a lot of strain, it puts a lot of pressure on the heart. So what happens over time is the left chamber of the heart, which we call the left ventricle, it becomes thicker, it becomes bigger and thicker, and then it loses its efficiency as a pump in pumping out blood. So people who have failure might start to develop things like leg swelling, reduced exercise tolerance. They may not be able, they may find they're not able to lie down flat at night. They're needing like 2 or 3 pillows to prop them up because they feel breathless. Kidney problems as well. So when the blood pressure is high, it could damage the vessels supplying the kidneys. The kidney filters, waste products, it filters fluids out of the body. But when they're damaged as a result of high blood pressure, then the body starts to retain things that is supposed to be clearing. So people might present with things like, leg swelling, facial swelling, anemia, etc. And then we talk about hypertensive emergency versus hypertensive crisis. So emergency is when both of them are when the blood pressure is actually above 180 over 120. Difference being with a emergency, it means there's already an organ damage. Organ damage could be any of the organs. It could be a stroke. It could be the heart, where people can present with a heart attack as a result of the blood pressure being very high. It could be a visual loss, due to acute damage of the blood vessels of the eyes. That's what makes it an acute. That's what makes it an hypertensive emergency. For crisis means the blood pressure is very high, but there's been no organ damage. People don't have any symptoms. At that level, you can still manage them in primary care, like in a GP surgery setting. You can be started on medications, and your GP can arrange routine tests for you to make sure there's been no damage to any of the organs, and that could happen in a few weeks. Please don't forget to put your questions in the chat so we can address them at the end of this. Thank you very much. So we now go to treatment of hypertension. So basically, treatment is so there's drug treatment and there's non-drug treatment. We usually emphasize lifestyle modification. Number one, my colleague already mentioned, Sean, already mentioned about reducing our salt intake. So the recommended amount of salt for in a 24-hour period is less than 6 grams of salt, which is the equivalent of 1 teaspoon of salt. And if you can have maybe even half of that, which is 3 grams.
I just wanted to tell you to mute Isaac, but you are it's me. Isaac. Isaac was but he's muted now.
Oh, thank you very much, sir.
Yes, sir.
Sorry.
So salt intake, so cutting down salt intake is very important because what is, when you reduce your salt, it can help reduce your blood pressure, the systolic one, the upper one. It can help reduce it by at least 10 millimeters of mercury, by 10 units, in a few weeks, which is a significant drop. So we usually, it's quite difficult, especially for us of this ethnicity, to eat food without salt. But what we do actually really we have other options. So things like you could try spices, herbs, other replacements like garlic, could be used instead of salt. Your taste buds will get used to it over time. So it's very important. Even when you buy products outside for consumption, just check the labels to make sure it's like low salt product. So that's one thing that we need to keep an eye on. Also, our diet. So we usually recommend, so a lot of us use, sometimes when we buy like granite, we usually recommend even like grills. If you could grill your meats, grill your fish, etc., instead of frying with oil, that's even better. But if not, let's ensure that the oil that we're using, the granite oil we're using is unsaturated fat, so make sure is that. So things like rapeseed oil, olive oil are usually recommended, sunflower oil as well. And just also be aware that palm oil contains a lot of cholesterol. So if we could cut down on that or even avoid it altogether, then that's really beneficial. Plenty of fruits and vegetables should be incorporated into the diet as well to maintain a healthy lifestyle. Exercise, we usually recommend 150 minutes of exercise a week. So you can split that as 30 minutes of exercise over 5 days, and we're talking about aerobic exercise. So exercise that makes you maybe breathe a bit faster or makes your heart pump blood a bit faster. They're very healthy for us. Weight reduction. So we need to be aware of our BMI. We already talked about this in the past. So let's be aware of our BMI. There are different options. For those some people struggle to lose weight because they have other conditions and they're not able to exercise as they would like. Some people maybe have like arthritis, which may impact on their ability to exercise. Or some people may have other conditions that make them maybe a bit too breathless after minimal exertion. So, but there are local weight management services available. You can speak to your GP; they could refer you to them. There are medications that can help lose weight and some injections as well, because with the weight loss, you also experience a reduction in your blood pressure. For those who are diabetic, it helps with the control of their blood sugar. And just generally being healthy as well. Even those who suffer with arthritis, osteoarthritis, wear and tear in the joints. When you lose weight in the upper part of your body, you feel less pressure in the lower part of your body, generally. Less caffeine. So we generally recommend less than 3 cups of coffee a day. So those who, the coffee enthusiasts, should please stick to less than 3 cups of coffee a day. Smoking and alcohol. Generally, we recommend smoking cessation for those with a high blood pressure, not just because of their blood pressure, but because of the risks of things like cancer, respiratory diseases, etc. Alcohol reduction is very drinking it in moderation is recommended as well. Medication. So that's for the non-drug aspect, which is lifestyle. And in terms of medications and compliance, we usually so the medications are guided. The treatment are guided by things like the age. So our guidelines that we use, if you're a certain age, if you're less than 55, there's certain medication you need to be started on if your blood pressure is high. If you're more than 55, the first choice of treatment will be different for someone who's less than 55. This is in Caucasians. If you're for Afro-Caribbeans, for us, Black people, there are medications that work in Caucasians that should not be used in Black people, so which is why it's very important to have regular checks, regular reviews of regular medication review. So that's that. The other thing that guides the choice of medication of whether to start treatment or not is something called a Q risk, which assesses risks of developing a heart attack or stroke in the next 10 years. So if your GP says, if you've had a cholesterol test, maybe a cholesterol blood test, there's in our setting in our GP surgeries, there's for everyone actually, there's a sort of like a calculator on the system that automatically imputes your cholesterol level, your risks that you have, your weight, your height, etc. And it works out your risk of having a heart attack or stroke in the next 10 years. If that comes back as above 10%, then there is a risk. And then you might find your GP talking to you about offering you a statin, which is a discussion for another day. So in such people, statins are beneficial because they help reduce that risk of getting a heart attack or stroke. So if your blood pressure is maybe borderline high and you're wondering, should I start this person on treatment or should they not start on treatment? We may look at your Q risk. If your Q risk is high, which means you're almost the double risk, blood pressure is high, your Q risk is high. So it's probably best to start treatment rather than just lifestyle alone. So that's for the Q risk. And then race, we already talked about that. And any other medical condition that someone may have, maybe you have maybe people may have diabetes or chronic kidney problems, heart problems, etc. If the blood pressure is even borderline high, it's probably best for them to be started on medications. So, and some of those medications include things like, which some of us will be familiar with, amlodipine, ramipril, doxazosin, indapamide, etc. So that, and it's very important that we are compliant with our medications. So the key takeaway from the presentation is number one, health checks, the importance of health checks and annual reviews, cannot be overemphasized. So if you're above 40 and above, the NHS will send you an invite, to come and have your MOT to be checked. They will check your blood pressure. They will check you do blood tests as well to make sure there's no health issues that need to be that needs to be reviewed, and you need to be started on treatment promptly. So we need to take our health checks very seriously. Some people who have a high blood pressure are on treatment, and some people never go for, maybe they started on amlodipine 5 milligrams. Once they've started, they just carry on taking the medications. They don't really go for checkups. They don't go for reviews of their medications. They don't discuss it with anyone. Some people even just stop their treatment, maybe because one day they check the blood pressure and it's normal, or they checked it for 2 days and it's normal and just decide to stop treatment. So there's always, what could happen is, because as we mentioned, it's a silent killer. You don't necessarily have symptoms with a high blood pressure. So if you're not checking your blood pressure regularly, at least weekly, make sure that you're having checks, regular checks with your GP. So if you're here and you haven't, maybe you've been diagnosed of having a high blood pressure and you've stopped your treatment, or you've been taking treatment for a long time, and you've not had any review, soon would strongly recommend or advise that you book an appointment with your GP for a medication review. And the other thing is compliance and regular medication. We've talked about that already. So very important to stick to your medication. Some people may have the query of, it may feel very put off by the fact that you have to take medications for life. But the thing is, if you start treatment for your blood pressure and you're taking it regularly, and you're combining it with lifestyle, some of the lifestyle things we talked about, reducing your salt intake, exercising regularly, weight loss for those with a high BMI. If you're able to combine that, after some time, you may find your GP telling you, okay, we need to reduce your medications because your blood pressure control is quite optimal. Maybe after some time, they may stop it, and then you keep reviewing from, periodically to make sure it's not crept back up. So it's very important that if you wish to stop your medication, you need to have a decision. You need to do a joint decision with your GP or speak to them before making that decision rather than just doing it on your own volition. And then advice and guidance from the church medical team. So we are here to, we are always here to help. if you ever have any queries about your medications, your blood pressure medications, or even any medical queries, myself, I'm there. Dr. Sean Falashe is there. Dr. Tubosun Falashe is there, and boss Dr. Dr. Rotimi Bakare is there as well. Can always give advice, on your medications. We may not be able to give you the treatment for your blood pressure or or change your medications, but we can give you advice and guidance of what you need to do, or guide you on the kind of discussions you need to be having with your GP. Also, if you want to check your blood pressure, maybe you haven't checked it out, or you have doubt about your blood pressure monitor at home, we can always help you check and confirm that your blood pressure monitor at home is working correctly, because sometimes people may not even know that the blood pressure monitor is not working. It may just tell you everything is normal. Meanwhile, your blood pressure is high, and you need to be taking more medications or higher doses. So you have any queries whatsoever about your blood pressure, please feel free to meet myself or any of us, any member of the medical team, to get advice on your medications. Yes, so that's the end of the presentation for now. We do have a few questions from the last time, which we haven't answered. So we'll just use this opportunity to address those questions. In the meantime, if you have any questions, please do not hesitate to put them in the chat so we can address them in the limited time that we have. Thank you very much. So I'll just hand over very quickly to Dr. Sean.
Thank you very much. Dr. Falas and Dr. Fabi. I think if there are questions in the box, maybe we take them now before I start the prayers. If you want to take about 5 minutes or so, max. Dr. Falana.
Okay, I think there are no questions for now. So we just use 2 minutes to answer, the questions that we have from the last time.
Okay, go ahead then.
Yeah, so I just call on Dr. Sean Falashe to, if you could just kindly read out the question and just address it very quickly. Thank you.
Okay, so the first question I've got here says that why is hypertension commoner in menopause or after menopause, so to speak? And so, like I mentioned earlier, usually estrogen, which is the primary hormone that women produce in their reproductive years, it's usually helpful with smooth muscle relaxation. It helps us with our blood pressures. It brings down our blood pressure. It makes everything just calm down. Yeah. So the smooth muscles are relaxed, and then there's a decrease in our blood pressure. So what we menopause, estrogen supply is cut off. So the body then does not have that covering anymore. So we find that there's an increase in blood pressure. There is also, stress. Stress is also another reason why we find blood pressures raised after menopause, as well as weight gain as well. So that also increases blood pressure after menopause. The other question would be which blood pressure monitor is preferred, which blood pressure monitoring devices are recommended. So preferably, would be an automated blood pressure monitor would be better than a manual one where you need to recalibrate, you need to have like some skill to record the blood pressure. So anyone that's automated that is advised by NHS would be better. And then that would be the better one to use as opposed to the manual one, like I mentioned earlier. Yeah. Dr. Lano, do you want to take the other questions? Do you want me to read them out? Yeah.
No, thank you very much, Sean. Thank you very much, Sean, for addressing this question. So I'm just going to address one question that's popped up in the chat. We can address the other ones later because of our time. So can a sickle cell patient develop a high blood pressure? Yes, that's very possible. So what happens with sickle cells, because the red blood cells are, they're sickle, they quite, instead of the normal biconcave shape that they are supposed to have, they're quite elongated, and they're blocking the ends of the blood vessels, so that can affect blood flow, to the rest of the body, which is why you may even get crisis. But also it can affect the blood vessels in the lungs as well, which is why sickle cell patients might get what we call pulmonary hypertension, which is high blood pressure within the lungs. So that's something that can happen, and it quite commonly could affect young people, young adults, and even teenagers with sickle cell. But having said that, there is treatment available for high blood pressure in sickle cell, which is the exact same as the other demographic of population. So non-sickle cell people, the same treatment or the same guidelines that will apply in treating them is the same one for treating sickle cell patients with high blood pressure. I hope